Muy buenas tardes a todos. Ya prácticamente para cerrar este gran evento, tendré el honor de moderar la conferencia magistral titulada Envejecer sin empobrecer, ahorrar para nuestro retiro. Para lo cual nos acompaña una de las economistas más destacadas del mundo, gracias a sus valiosas contribuciones para la comprensión de la pobreza y el desarrollo, así como de la forma en que ambos fenómenos se ven influenciados por el mercado y las políticas que buscan reducir las desigualdades. La profesora Esther Duflo se ha dedicado a estudiar la forma en que las personas toman decisiones económicas. Sus investigaciones buscan entender a los más vulnerables, con el objetivo de ayudar a diseñar y evaluar políticas sociales. Tiene experiencia en los campos de salud, educación, inclusión financiera, medio ambiente y gobernanza. El trabajo de la profesora Duflo se ha concentrado no únicamente en ofrecer teorías que busquen entender y explicar cómo funcionan estos fenómenos sociales, sino también recolectar experiencias de cómo se han abordado estas problemáticas en el mundo, permitiendo que el diseño y la evaluación de políticas públicas se haga desde una aproximación más razonada y basada en evidencia. Es un honor tener el día de hoy a la profesora Esther Duflo con nosotros, ganadora del Premio Nobel de Economía en 2019. Por cierto, la representante más joven de la historia en recibir esta distinción. El Premio Nobel le fue otorgado, junto con sus colegas Abhijit Banerjee y Michael Kramer, por sus contribuciones a la comprensión del desarrollo y la reducción de la pobreza. Su trabajo ha transformado la economía del desarrollo con un acercamiento guiado por la teoría y el uso de datos, pero con foco en identificar políticas viables sobre las cuales se puedan hacer afirmaciones causales del impacto. La profesora Duflo cuenta con estudios en Historia y Economía de la Escuela Normal Superior de París y posteriormente obtuvo un doctorado en Economía del MIT. Esther Duflo es profesora de Economía en temas de alivio a la pobreza y Economía del desarrollo, cofundadora y codirectora del Laboratorio de Acción contra la Pobreza Abdul Latif Jamil Poverty Action Lab en el Instituto Tecnológico de Massachusetts. A lo largo de su carrera, también ha recibido numerosas distinciones, entre las que destacan el Premio Princesa de Asturias de las Ciencias Sociales en el año 2015 y la medalla John Bates Clark en 2010, que distingue al mejor economista en Estados Unidos menor de 40 años. La conversación que tendremos con la profesora Duflo nos permitirá conocer su perspectiva sobre la importancia del ahorro para el retiro en la construcción de una sociedad más igualitaria y justa, lo cual resulta esencial en una coyuntura como la que actualmente atraviesa el sistema de ahorro de nuestro país, dada la relevante propuesta de reforma que el Ejecutivo, con la participación de empresarios y representantes sindicales, presentó recientemente al Congreso de la Unión y se encuentra en discusión, con objeto de mejorar la calidad de las pensiones de los trabajadores mexicanos. Sin más preámbulo, recibamos por favor a la profesora Esther Duflo. Welcome, Professor Duflo.
Thank you. Muchas gracias. I'm pleased to be here today in these interesting times where you are thinking about how to redesign the pension program in Mexico. And I have a presentation that I'm going to share, if you'll allow me. Right, so today I was going to be talking about pension and poverty in emerging economies with some lessons for Mexico. We are living in an aging planet. Mexico, for once, is aging rapidly. From 2010 to 2050, the population 60 years and above in Mexico is projected to increase from 8.9% to 21.5% of the total population. For those age 80 or over, the fraction is projected to rise from 1% to 6%. And we are in this mix of infectious mixed diseases profile, which exists in many emerging markets. which is the prevalence of chronic diseases like diabetes, for example, and hypertension, which with a continuing moderate or high incidence of infectious diseases that are more characteristics of poorer economies. And this is potentially a pretty deadly mix for the older population. Mexico is not alone in this situation. This really reflects a worldwide trend. Globally, older population are increasing more rapidly than any other age group, including in poorer countries. And this really causes an unprecedented challenge for poor and middle income countries, which have to deal with financial security of an elderly population, while the rest of the active population is themselves poor. And in this context, pension play a key role. So let me talk a little bit about pensions and poverty to start with. So poverty in old age is common in middle and low income countries. For example, in Mexico in 2018, 7.8% of the population above was 65 years or older. And of those, 41% lived in poverty, almost 35% lived in moderate poverty, and 6% lived in extreme poverty. So this is a situation that was already, rife with issues, especially with declining GDPs or declining GDP growth in the last few years. And then COVID-19 hit Latin America and the rest of the world. But Latin America was hardest hit by COVID-19, with death and caseload similar to the rich countries, but without the resources that the rich country had to defend themselves, and in particular, to deal with the economic consequences of the crisis. And of course, everywhere, the elderly are particularly hard hit by the COVID-19 disease. So here I have some data for Chile. That's not Mexico, but that's the closest country I could find with a high testing environment, where the data is quite reliable, which gives you the fatality rate for those who are infected with COVID-19. What's the chance that they have of dying? And as you can see, for young people, the fatality rate in Chile is very, very low, less than 1%. For those aged 40 to 49, it increases a little bit. But then when you get above 60, it's 4% for the 60 to 69, 12% for the 70 to 79, and 27% for people aged 80 and other. So for all people, we really have like a first, that's the first leg of this big COVID-19 attack, which is they are particularly vulnerable to it. And of course, the other reason why they are particularly hit by the COVID-19 crisis is because they are also particularly hit by the economic consequences of imposing lockdowns. So Latin America, like many other countries, imposed a rather severe lockdown. There was then, of course, the lockdowns didn't hit people equally. And if for anybody who had access to a regular salary, who was able to access loans, they had that possibilities. For anybody who was already a recipient of social transfers, they had the possibility of increasing the social transfer. In Latin America, the COVID-19 response was largely made of social assistance. So the idea of helping people in a non-contributory fashion. So you can see that 72% in Latin America, 72% of the social protection COVID response was social assistance. Whereas in Europe, for example, there was more done via labor markets or via social insurance programs like unemployment insurance. But the problem that many countries hit, and this was the case in Latin America, is that many informal workers who were hard to reach because they were not already registered somewhere. They were not receiving some form of help already, and therefore there was no way to actually find them. Because in most normal time, the goal of social assistance is to exclude those who don't need it. And so most of the effort is to avoid errors of inclusion. But in COVID time, the objective was to include as many people and to avoid errors of inclusion where people would, whereas people who should have been helped didn't get help. And I think the although I don't know it for a fact, that many elderly were found themselves in this situation where they're sort of fallen through the crack of the system. So a robust non-contributory pension scheme can solve both the problem of reaching the hard to reach and of helping particularly the elderly, because a non-contributory pension system can be put in place in normal times, in non-COVID times, and then you have in place a system that covers in principle every old person, regardless of their status. Which is not related to how much they have saved during their lives or whether they have contributed to a pension scheme. And many emerging market countries have non-contributory pension schemes in place. Brazil, South Africa have prominent such programs. And there is a non-contributory pension scheme in Mexico, which was put in place progressively, increased progressively. As of 2013, the program Pension para Adultos Mayores covers all persons 65 and above who are not receiving any other social security benefits or state-level non-contributory pension. The expansion of this program was gradual, so it started with rural areas and small towns. It started when people were 70 or older. And then as of 2013, it was expanded to the rest of the towns and people 65 or older. So we actually have an evaluation of this program by Sebastian Galliani, Paul Gertler, and Bando from the, it's an IADB working paper. And what they are looking at is the situation before 2013, where the program was only available in the small city and not in the large city. And it was only available to people who were 70 or older. So what they're looking at is a difference in difference design, where they are going to compare people who are old enough to receive the pension in the places that are treated, which means where people are eligible for the pension. So places which are not too small, not too big, localities of 500 to 2,500 inhabitants. They're going to compare the people who are old enough to people who are not quite old enough. And then they are going to adjust for the difference due to age by subtracting the same difference for those who were who would have been age eligible but live in cities that are too small to receive the pension. So what I'm going to show you here on the column, which is called treatment effect, is the various, it's the impact of this program on various measures. And when you see little stars, it means that there is an effect that is actually large. And the first things you can see is that there was a decrease in the geriatric depression scales. So in other words, old people were less likely to be depressed when they received the pension. They were less likely to be working for pay. They were more likely to be volunteering instead. If they worked for pay, they worked fewer hours. Also not shown in this graph, but in another graph, the labor supply did not affect, the pension did not affect the labor supply of other adults in the family. So it's not that it made other people lazy when they lived with the pension recipient, but it increased the family income and therefore the family consumption. So the pension really played a role both in keeping the elderly happy, in keeping them engaged in the community, but not through paid work, and increasing the standard of living of very poor households. So this was the effect of the program, the Mexican program in normal time. So we are looking at before 2013. But an interesting question is whether the pensions were able to play a protective role for the elderly, in particular during the COVID-19 crisis. So then what I'm going to show you is some research that I've been doing with my collaborators in India, where I'm going to show you an example of what is the frontier of research in impact evaluation, which is randomized controlled trials. A randomized controlled trial is what I've been doing all my career. And the idea with randomized controlled trial is to evaluate the impact of social policy with the same type of rigor that you would evaluate the program, or the effect of a new drug. So for example, there is currently a coronavirus vaccine trial going on. I'm sure you have heard about it, and you've heard numbers such that is 90% effective. So what does it mean when we said that the coronavirus vaccine trial is 90% effective or 95% effective? It means that they took 30,000 people, they randomly divided into two groups of equal size. To one group, they gave the vaccine. To one group, they gave the placebo. And then they waited to see whether anybody was going to be infected with COVID. And what they found is that after about 2 months, 195 people got infected by COVID, and almost all these people who were infected by COVID and became sick with COVID were in the placebo group, which suggests that the people who were in the treatment group were very well protected by the vaccine. And the key and the reason why we can trust these results is because they were on a very large sample size and people were randomized. So there is nothing different about those who receive and those who don't receive the vaccine. Well, it turns out that we can do the same type of approach, not just for vaccine or for new drugs, but also for social programs. So the idea is to compare exactly identical people, some who receive a program and some who don't receive a program. And ideally, we would like to do that with pension, if that's possible, to know what is the causal effect of receiving the pension. But usually, everybody who receives the pension, who is eligible for a pension receives it, and you cannot really randomize who receives it. So we got, a few years ago, we got a unique chance to do this in Tamil Nadu, which is a state in the south of India, which is a pretty wealthy state, which has a very rapidly aging population. And Tamil Nadu has a non-contributory pension scheme, which is for very, very poor old people. Well, we worked with the statistical office of the government to identify people who were eligible for the pension but did not receive it. They did not receive it for any number of reasons. Either they had not been screened, or they had not applied, or they had been screened but they had been rejected. But everything in the way that they lived suggested that they would probably be eligible. So in 2018, government surveyors identified a little over 1,000 elderly people not receiving the pension, but likely eligible for it. We chose half of them randomly to the government, and they reconsidered them for pension. They didn't give the pension to all of them. In fact, of the people that we gave them the list for, this is the group called 2 in the graphic that you see here, 42% of people were given access to the pension. And of the people in the treatment, in the control group, we didn't give their name, but maybe some people get reevaluated anyway, about 8% got the pension. So it's not 100% different, but it's a percent that is large enough. It's a difference that is large enough that we might, if there is a large effect of pension, we might be able to see the difference in the outcomes. So in many cases, the pension started in April 2020, so in the middle of the COVID crisis. So we were kind of waiting to measure the effect a little bit later. But when the COVID-19 outbreak happened, we immediately launched a phone survey with elderly people. We were not able to reach all 1,000 of them because not everybody had a phone, but we were able to reach about 550 of them. And we just asked them, how they are doing, what is their financial security, what is their health and well-being, whether anybody helps them in this period, and so on and so forth. And what we find is very interesting. So I'm showing you here the results. I'm showing you, when you see the variable treatment, it's the difference between people whose name were given to the government and people whose name were not given. And in the column that says IV, the column that is the even column in this, it's the effect of receiving the pension. And what you're seeing here is that for people who receive the pension, the food security improved. They're much less likely to say that they are starving. There was no effect on medical access or the mental health index, worth mentioning. On the other hand, they were more likely to be supported by their family, and they were also more likely to respect social distancing. So the pension protected the elderly during the pandemic by giving them better food security, more support by family members, and they were more likely to practice social distancing. And this is shown very rigorously via this randomized control trial. So by the way, we presented this result to the government during a steering committee, and the government was interested in scaling up the pension to other people and making sure that everybody who was eligible to the pension was able to get it, because that's a sort of a very natural way to ensure that none of the particularly fragile people in front of COVID-19 are missed out. And it shows the importance of existing program, to have robust existing program of pension coverage in normal time so that they can be activated and present to help people in crisis time. So in the second part of my talk, I'm going to be talking about saving for retirement. So until now, I've been talking mostly about non-contributory pension, which is what people who were not able to save for retirement, either through their work or through individual savings account, receive from the government. And what this has shown is that it's very important to have a decent pension for elderly well-being. And ideally, the pension is not only covered via non-contributory programs, but it also, and mainly come for the majority of people, come from savings that they have accumulated throughout their lives. You mentioned in your introduction that there is a reform plan in Mexico by the executive branch with support from many in the business community to increase the amount of pension contribution by employers and increase the final replacement rate. So under the proposed reform, the workers will increase their contribution to their retirement savings to 50% of their salary from 6.5 over 8 years, while the employers would increase their contribution to 14% from the current 5.15%. Also, 15 years of formal work would be enough for eligibility. So even people who have contributed to pension for only part of their career would still have a formal pension. So that's a very important reform because what we have seen from the experience in many countries that had shifted to voluntary contribution from programs where the contribution is automatic via employer-employee contribution is that voluntary contribution are very difficult for people to manage. They don't get around to sign up for them, or if they sign up for them, they don't get around to rebalance as they should. So in my opinion, the world has been moving away from this automatic contribution by employer and employee, for example, in the US or in Chile long time ago. And the experience has been, let's say, more than mixed. Compared to setup like the French setup, for example, which is to a very large extent rests for the majority of the pension on systematic contribution by employer and employee. So that's I think going in the right direction, but there is still the issue of the informal workers, and in particular. One thing that has been pointed out in the context of this reform is that in the short run, this increases the gap in labor cost between the formal and the informal sector. The informal sector is quite vibrant in Mexico, and as Santiago Levy, for example, has argued, the gap in the cost of labor coming from this contribution to pension system and social security, as well as health insurance, is one reason why many workers are either completely informal or partly informal and formal, and many firms actually coexist formal and informal workers. And therefore, that raises the issue of informal workers in two ways, in a way, both because they need to have a way to save for retirement, both because they need to be saved for retirement, for their own retirement, because otherwise, at the end of the day, there is a Good Samaritan dilemma, which is the non-contributory pension program is going to cover them, and who pays for that at the end of the day? It's going to be taxpayers in general. So it should really be that the informal workers who are making enough money are able to save for their retirement. And also if they save for their retirement and internalize this saving for their retirement, then it wouldn't make the informal sector so much more desirable compared to the formal sector in the short run, because on the one hand you would have the contribution to the pension system, and on the other hand you would have informal savings. So in terms of what is in your pocket to consume, that would be equivalent. So that raises the issue of how can we put in place a system that allows informal workers to save for retirement, and in fact nudges them to save for retirement. So I think the key point is that they need access to individual retirement savings accounts, and it must be very easy and transparent to participate. And here we have a lot of evidence from the US, which has retirement accounts to people, on what would make a successful system for retirement savings. This is in particular research by Bridget Madrian and her colleagues, David Leibson, John Beshears. And I think the way you can summarize it in just 3 words is make it simple. So how do we make it simple? Well, first of all, there should be default choices and automatic enrollment. So you basically, if possible, everybody should be enrolled in an individual retirement account. Now you're going to ask me, how can we automatically enroll people who are informal workers? And I'll give you an answer in a minute. But ideally, what works the best is automatic enrollment and default choices. So default contribution amounts, some fraction of your salary, default investment allocation, ideally an age targeted fund that you plan to retire at 60, and this is doing the work for you. This is, for example, what my entire 401k is invested in, is something that target my retirement age. Financial education alone is not enough. When you give people financial education, explain to them what they should do, the effects are moderate or they really have no effect. Because in addition to the knowledge, there is also the difficulty of acting on the knowledge. So it's not sufficient for people to know that they must save for retirement. It's not sufficient for people to know what they should be doing. They tend to undersave, to not be registered in a plan, and if they save, to have silly allocations such that 50% bond, 50% stock, that don't make any sense. Matching contribution to create incentives. And here the government has one in Mexico, which is people have, the government can match contribution of informal worker in their accounts. So that's a great tool to have. Also safeguarding retirement savings by reducing leakage. What does that mean in plain English? It means that people should not be allowed to withdraw in advance. And with COVID-19, there is a huge pressure to allow people to draw on their retirement saving. And I think it's potentially very dangerous. It would be much better to give them loans that are separate, because then they won't have the money when they need to retire. So this package is very nice for people who are employed. For people who are employed, you can set things up in their retirement fund to satisfy all of these things. Basically, by default, people are enrolled. By default, they contribute, say, 5% of their wages. By default, they are on an age-targeted retirement. And then maybe the employer matches the contribution to some extent, and it's costly to retire, to take the money before you're allowed to do it. But how do you do it for informal workers? How do you replicate as many of these features as possible for informal workers? And here, I'll give you one example from Afghanistan, of all places, which is a much less, organized places than Mexico. So if it could be done in Afghanistan, it could probably be done in Mexico. This is an excellent paper by Josh Blumenstock, Michael Kellen, and Tarek Ghani, looking at a program called M-Pasandas in Afghanistan. So this is, Afghanistan has put in place a payment by phone system, which, so an electronic wallet on people's phone. And once you have in place something like that, you can use it for people to get paid by their clients, to get paid by their the people they sell to, or to be paid by the people who employ them. So even if you're informally employed, you can still be paid via a transfer to your phone. Once you have that in place, that both entrepreneurs or employees in informal shops are set up to be paid via transfers to the phone, then you can immediately arrange withdrawal of payment delivered to telephone via an electronic account to a savings account, which can be put to be a retirement savings account. So in this case, the Empobrecer program was done from at payroll. So this was done also for formal workers who received their salary directly on their electronic wallet on their phone. But this could be done, this is something that could be done for informal workers. And they could be by default set up such that a fraction of their payment goes straight in their retirement account. And they could decide to opt out of that system, but they could be enrolled in it by default. And they could also be, you could have that, on top of that, you could have the matching, the government matching on any fund that is that's left on the account. And what I'm showing you here is, for this particular program, a huge effect of an impact of default enrollment. So what the researcher did is that on top of this, of the basic system that takes out the money of your account and puts it in your savings account, for 6 months, they enrolled people by default. Then after 6 months, they forced them to take a decision. Here is what, do you want to keep it or do you want to not have it? And what you can see is that during the 6 months where it was there by default, you have many more participants, around 80 participants. They were allowed to opt out of it, but most people did not. And then when they had to make a choice, there is still more people who elected to stay with the savings account than to not have it. And therefore, they saved more. This study also had a match, and when you compare the impact of the default, it's about the same as the impact of a 50% match. But of course, if you had both the default and a match, then you could really have a lot of money going into the account, and a significant cushion even there who would be there even for the informal workers. So in conclusion, pensions are key to the well-being of the elderly, and you need a three-pronged approach: a non-contributory system that's inclusive and generous enough to prevent poverty and protect the health and the mental health of the elderly. The second pillar is a strong employer-based contributory system that's easy to navigate for employees and offers sufficient replacement rate. So in my opinion, the system towards which Mexico is going now is probably effective, of having more replacement rate offered through direct contribution. And then a third pillar through retirement savings account, where where the people who are in the contributory system could also decide to contribute to get an additional money, but it would be mostly easily available to informal workers. And we need to make sure that they are simple, that they are transparent, that they are automatic, and that they are matched. Thank you very much for your attention, and I'm happy to take any additional questions you may have.
Muchísimas gracias, profesora Duflo, por su presentación y compartirnos sus ideas. Al escucharla nos damos cuenta de lo complejo que resultan todos los elementos que involucran el mejorar las pensiones en el mundo y lo desafiante que tienen. No hay una sola fórmula y es la combinación de muchos esfuerzos lo que nos podrá llevar a solventar este desafío. Estoy seguro que serán de mucho valor todas sus ideas para los trabajos de este encuentro. Y ahora me gustaría aprovechar los minutos restantes que tenemos para proponerle algunos temas que permitan aprovechar su experiencia para mejorar la calidad de vida de las personas en su retiro, buscando erradicar la pobreza en la vejez como principal objetivo, que tristemente afecta a millones de personas en nuestro país y en todo el mundo. Así que si le parece, entremos de lleno a la sesión de preguntas y respuestas. Y yo quisiera preguntarle, en su opinión, ¿cómo se puede evitar la pobreza en la vejez? Y basado en su experiencia, ¿cuáles son las políticas públicas que mejor funcionan para mitigar este problema? Es decir, ¿qué políticas han funcionado bien en otros países que han dado buenos resultados y qué recomendaciones daría usted para el caso de México?
Yes, gracias. So I think that this is basically jumping on from the conclusion that I gave. I think you need three pillars. To avoid poverty in old age, you need a robust non-contributory system. So a minimal pension that is available to all people if they have not if they have no other way of living. So for example, they don't have access to a contributory pension. And this is what you have in Mexico. What's important is that this program works well, that it is sufficiently high. So in many countries, there is a small non-contributory pension, but it has issues. For example, it is in India, it is very hard to subscribe to it. It is very difficult to prove that you are eligible. And one of the big objective of the program seems to be to kick people out as much as possible. So that when we looked at a sample of older people, we found out that the people who looked eligible but were not getting the pension were actually much poorer than people who looked eligible and were getting the pension. So that system was so good at excluding people that it was mostly excluding the poorest of the poor. So what you need to avoid poverty in old age is a non-contributory pension that is good at finding the poor person. And for that, it needs to be very easy to access, where basically, first order, everybody is eligible unless they have access to a private pension. So in South Africa, for example, at the end of the apartheid, they put in place, they had actually an existing pension program, which was very, very small for the Black people. And they were wondering what to do with it to equalize the system of the Black and white people. And they decided that basically they are going to make it available to everyone who doesn't already have a private pension. And that ended up being 85% of the age eligible people. And it was a very generous pension program. And that definitely did a lot to avoid poverty in old age. And because often old people live with other members in their households, that also avoided poverty of children and had downstream impact on children. So I think that's the most important part, is to have a non-contributory pension, make sure it's generous enough for people to survive on, and make sure that it's basically available to anyone over a certain age, as long as they don't have a private pension, and not be too specific on the assets and the ability of your children to support you and all of that, because those type of exclusions and hoops to jumps only serve to make the program less effective to combat poverty.
Thanks for that, Professor Duflo. And I don't know if you agree with this, recognizing the importance of a multi-pillar system to solve this problem. The challenge for governments is where to find resources, for that purpose. And in the long run, moving from a non-contribution system to a contribution system may make more sustainable the pension system in the future. I don't know if you can elaborate a little bit on that, please.
Yes, so absolutely. Well, this is what I elaborated. This is basically the conclusion slide, which is you need three pillars. You need the non-contributory system, a contributory system that's available to everyone in the formal sector and that's automatic and with sufficient contribution for people to basically survive nicely on their pension if they do nothing else. which is what you have, for example, in most European countries. And then a contributory system for the informal workers. And I think in a country like Mexico, this is where you have the tension, because the more generous in a way, or the more you fund the formal retirement system, the more it creates a gap with the voluntary contributory system. And therefore, the more you're likely to have people drop out of that system and end up on your non-contributory system. And the non-contributory system has to be funded from general tax revenues. So that's a problem for the economy that can become very expensive because the population is aging. So that's why I think those three pillars really go together. But for the first pillar of non-contributory to be sustainable at a level that's sufficient to avoid poverty, it is really absolutely essential to have a third pillar for informal workers that is sufficiently robust that a lot of workers that will end up spending most of their life working in the informal sector end up with a pension. And that's why I spent most of my time today on this second part to discuss ideas about what to do there. Because I do think that for the formal sector, the reform that is in place that is discussed now in Mexico is going to mostly take care of the formal sector.
Muchas gracias por compartirnos estos conceptos y recomendaciones. Digamos, como un segundo bloque, me gustaría participar con usted, un poco hablar sobre el comportamiento de las personas y cómo impulsarlos para pensar en su futuro. Así que, reconociendo los beneficios de diferir el consumo presente en favor del bienestar futuro, en su opinión, ¿cuáles son las principales razones por las que a las personas les cuesta tanto ahorrar voluntariamente para su retiro? ¿Qué recomendaciones nos daría para inculcar en los trabajadores la importancia del ahorro? ¿Y cómo incentivar a las personas para que se preocupen más por su retiro y tomen acciones oportunamente?
So that's a great question. So I think both rich and poor people suffer from the same problem, which is what behavioral economists call hyperbolic discounting, which in plain language means that the present is much more important than the future. So the present looms large, and we think that we need to do this expenditure today, or we need to do this thing now, and we want. And therefore, you always have the temptation to save, to spend your money now and not to put any money aside for savings. And for the same reason, we also have the temptation to never think about savings either, because it's kind of boring to even think about it. So these two problems compound, where we don't really think about it hard enough and we overspend. And this is true for rich people, and this is true for poor people as well. But the advantage that rich people have is mostly they're working in the formal sector, where that decision is taken for them, because automatically you contribute to your retirement, and so does your employer. So it's done. And therefore, when we think how to encourage people to think more about their retirement, it's not that the poor people are less careful about their retirement. Is that for rich people, if they make no decision, mostly they are going to be fine. But for poor people, if they take no decision, they are going to end up in a bad place. So that's why I suggested any number of systems that make it as easy as possible for the poor people, and in particular, automatic enrollment to a pension system taken out of the payment made through their accounts, for example, their telephone-based account, if one can be introduced for informal workers, combined with a match, which makes it more desirable to stay. And combined with a very simple, very transparent way to allocate the money, for example, a target-based retirement portfolio. And I think putting all of this in place is going to just put people on the right track, and once they're on the right track, most of them are probably going to stay there without giving it too much thought, and they'll end up in a much more favorable place for their retirement.
Muchas gracias por estos comentarios, profesora. Usted ha dedicado una muy buena parte de su carrera a estudiar los comportamientos de las personas. Por lo que a partir para el siguiente bloque le propongo un poco compartir sus experiencias al respecto. Y la pregunta sería, ¿qué nos dicen las evaluaciones de impacto para incrementar el ahorro voluntario? A lo largo de su presentación nos ha compartido algunos de los estudios. Yo quisiera centrar la pregunta en, la pasada fue un poco sobre las personas. ¿Qué deberían de hacer las personas? Del lado de los administradores de fondos de pensiones y del lado del gobierno y los reguladores, ¿qué deberíamos de estar haciendo mejor o diferente para promover este ahorro de largo plazo?
Yes, a great question. So I think I gave some answer to the first half of the question in my talk, which is, what do we know from evaluation? Number one, we know that default is hugely important, both being enrolled by default in a saving system and the level of contribution that is picked and the way that the saving is invested. All of that is extremely sticky. Once you set up a default, then people are just going to mostly stick to it. So that puts an enormous amount of pressure on the regulators and the pension fund, who are designing the choice infrastructure in the world of Dick Taylor, who got the Nobel Prize a few years ago in behavioral economics. They are the one who, basically, the choice infrastructure determines what are the default decisions, and therefore what are going to be the final decisions of most people. And the responsibility of the regulator and the pension fund is to put defaults that are in place that are favorable to people and lead to good financial decision, sound financial decision, as well as sufficient saving for retirement. So in my opinion, that means really managing to have in place a default system where even the informal workers are enrolled in a system, and also for the pension fund, making sure that they are enrolled in a system that doesn't have high management fees, in fact, that doesn't have management fees, and that is automatic rebalancing as people age. That needs to be the basic. It needs to be, the system needs to be designed such that the default option is the one that conducive to saving, that will work for most people, and that is financially advantageous for them.
Thank you for that. You said at some point of your presentation that financial education is not the only thing to do, but it's relevant. We believe it's relevant to improve financial education as well as these other policies that you mentioned before. On that, what is your experience on other countries that we can take as a reference of success for Mexico and the purpose of this initiative? Could you please elaborate on that as well?
There are many studies, including randomized controlled trial studies of financial education among various age groups, and in particular in schools, for example, which shows some effect where people do understand a little bit better. The evidence in terms of the impact for actual retirement saving is either inexistent or disappointing. So I still think it's important to have financial education so people understand what you are doing to them. But for example, when you run a randomized experiment where you invite people to a financial education session, and someone gives them the whole, explain to them why they need to save and how, and then so everyone gets that financial education session, but at the end, some people are put by default into a system and others are not. Then the ones who are not never really take the step. So it is, so I see financial education more as a complement of those active decisions or default enrollment, so that people understand and have trust in what is being done, rather than relying on financial education to be sufficient to lead people to take the right choices.
Thank you. Gracias por ello, Professor Duflo. I loved one of your last slides of your presentation when you said, keep it simple, 3 words, no? It is for a very complex problem and challenging problem. It's a good recipe. And typically from the technical perspective, we tend to make things very complex. So appreciate your comment. Just for finishing our commentary, your presentation, do you like to add something else for finishing your part?
No, I think this keep it simple is a very good place to finish. I think there has been a temptation for many years to add choices and to, in some cases in pension funds, in I think in Sweden they had like 50 options to choose from, and people, number one, have no idea how to make these choices, and number two, get paralyzed by too much choices. So in part, the more choices you give to people, the more they postpone the decision, and therefore the more they postpone savings. It also doesn't increase their trust in the system. So I think it is really very important to, and I think many countries are now going, pedaling back away from that, realizing also that people took decisions that were in the end detrimental to their financial security in old age, because they didn't invest in the right fund even when they invested. So keeping it simple, both for the people who participate to the formal sector contributory system, with basically very transparent choices, but not too many, and then that's relatively easy to organize for the formal worker. And the big job is that it's actually quite complicated to make it simple for the informal worker. But at least if we know that that's the target, that the objective is to make it simple, make it automatic, make it powerful, then we know what we need to work on and what's the objective for equitable and sufficient contributory retirement system for the informal workers.
Muchísimas gracias, profesora Duflo. Ha sido un verdadero placer conversar con usted, y a nombre de la Asociación de Administradoras de Fondo para el Retiro, le aprecio mucho su participación en este encuentro digital y espero tener la oportunidad de conocerla en persona y no solamente a través del Zoom, y que visite próximamente nuestro país, donde le esperamos siempre con los brazos abiertos. Un gusto saludarla.
Muchas gracias.